managing your mood during menopause. It can be a challenge for many women in their 40s and 50s, but there are treatment options. So here with advice is Dr. Michelle DeBlasi, a psychiatrist at Tufts Medical Center. Good to see you, doctor.
Nice to see you.
You know, we know women can experience some significant symptoms as their period ends. Which ones do you worry about?
Yeah, so unfortunately for a lot of women, there's a lot of negative symptoms that are really common when they're going through menopause. And a lot of them have to do with their mental health, mood swings, irritability, anxiety. But the biggest thing to worry about is depressive episodes. So we know that there's nearly double the incidence of depressive episodes around menopause. And so if you're starting to, feel more hopeless or losing interest in things you used to enjoy, it's really important to make sure you talk to your doctor about it to see if you're suffering from a clinical depression that needs further treatment.
Yeah, and hormone replacement therapy we know is one option for treating mental health symptoms. What else would you recommend?
Yeah, so if people are suffering from these mental health issues around menopause, like I said, things like mood swings, anxiety, irritability, the first thing I recommend is going back to the basics, making sure you're having a balanced diet, you're exercising regularly, you're sleeping well at night, because those things can go a really long way in improving your mental health. But certainly there are other things as well. There's therapy, things like cognitive behavioral therapy, learning mindfulness techniques. And if your symptoms are really severe, there are also medications that may be able to help, like antidepressants. So it's important to tell your doctor.
Well, do women typically have to continue these medications, though, or therapy for the rest of their lives?
The really great thing and reassuring thing is that the data shows us that most women who are suffering from some of these symptoms actually have those symptoms completely resolve or at least significantly lessen just with time. So that's really great. But it means that if your symptoms are persisting and aren't going away, it's important to talk to your doctor to make sure you rule out any other causes, like things like thyroid conditions or other mental health disorders, just to talk to your doctor about getting some relief. It's really important.
Yeah, absolutely great to talk about this. Dr. DeBlasi, it's always good to see you. Thank you.